Okay, I'm back again with surgical specialties and their cons to each specialty. Neuro. First of all, the positioning for neuro can be a pain in the ass because the majority of the time when you're working on somebody's spine, you're going to be prone. And prone is just a difficult position because there are so many things you have to watch for to make sure that patients aren't getting like a nerve injury or pressure injuries. And you're usually going to be in that position for an extended period of time, which means you have to be very, very careful with that position and how you position your patient to make sure that they don't get any additional injuries during the procedure. And also, like neurosurgeons, they're hit or miss. There are some of them I love, and then there's a few that I could just not work with. That'd be fine. Vascular is very similar to the CVOR, and that procedures can be kind of lengthy. They can run kind of long. They can get kind of, I don't want to say boring, but they kind of get kind of boring because you're just sitting, like, there's nothing to really see because your vasculature is very small. Like I said, there's nothing to see. You kind of just sit there and hang out, and whenever the procedures are several hours long, it can get kind of not boring, but boring. And as for plastics, plastics where I work at least is a lot of boobs. You can do other things, liposuction, and you can do um, trauma plastics where you're fixing like facial, like craniomaxillofacial things. Um, the best part about plastics to me is the doctors. I don't know, all of our plastics doctors are very interesting people. So I actually genuinely enjoy being in the room with them because they're kind of quirky. But um, yeah, I mean, that's all I can really say about plastics is boobs and quirky doctors.